Am I audible? Is my screen visible? Those who have the textbook, please mention the page number in the chat box. So biomedical waste management. The Pollution Control Authority in India that takes care of the biomedical waste management guidelines. Okay. I don't have the textbook with me, so I don't know the page number. So biomedical waste means any solid or liquid waste produced during the diagnosis, treatment, or vaccination of human beings or animals. Okay. So during these phases of treatment, diagnosis, okay, or even immunization, vaccination of either human beings or animals. So this applies to the veterinary hospitals as well. Veterinary hospitals and clinics as well. This applies. Okay. So anything that touches, usually we say anything that touches a patient's body, animal's body, has to be considered as a biomedical waste. Okay. So this is a typical waste composition in a hospital. 85% of the general waste produced in the hospital are non-hazardous. Okay. They don't possess any risk. But the remaining 15% of the waste produced by hospitals or healthcare centers, they are hazardous in nature. And there are two types of hazards: infectious hazards and chemical or radioactive hazards. Okay. So majority of the hazardous waste are infectious in nature. Okay. Just 5% of the hazardous waste are radioactive or chemical in nature. Okay. So this is the composition of hospital waste. And even not just limited to diagnosis, treatment, and immunization, even for research in human subject or animal subjects, when you do research, okay, or any activities related to research, in that also whatever has been used, solid or liquid, has to be considered as a biomedical waste. So waste management has these different steps. First, and the newest step is minimizing. As much as possible, reduce the material uses, okay, or at least reduce the size of the materials that are being used, bulk and size. Okay. Reduce the opportunities of materials being used, also reduce the bulk and size of the materials that are being used. Minimize it, minimize the waste as much as possible. Then segregate the waste at the point of production itself. As soon as the waste is produced, that point itself, segregation has to be done. Okay. So segregation refers to basic separation of different categories of waste. Okay. Animal waste, human waste, chemical waste. Okay. These are different. There are four main categories of segregation: color coded segregation. And this is the most crucial step in biomedical waste management as well: effective segregation. It alone can be a very effective tool in biomedical waste management. Recycled, cytotoxic, biohazard. Okay, these proper labeling is also done in the segregation section, so that based on the proper labeled bins, you can segregate your waste accordingly. The third step is collection. Okay, collecting the waste. So different types of containers are used in collection of waste. Okay. Waste from operation theaters, laboratory, wards, kitchen, corridor, etc. Lot of containers and bins should be placed in such a way that 100% collection is achieved. Nothing is left back. When the housekeeping staff or the biomedical waste handlers, when they come to collect the staff, come to collect the waste, nothing is left back. Everything is collected in one go. Ease of collection should be there. Okay. Sharps must always be kept in puncture-proof containers so that even for handlers it is safe, okay, in handling the and collecting the waste. Then you have transportation and storage. Transportation, either in trolleys which are covered. It is very important that biomedical waste is covered so that there is no spillage. Okay, trolleys or covered wheelbarrow can be used. Manual loading should be avoided as far as possible. Okay, bags, containers that contain biomedical waste should be tied properly and lidded properly, means cover it properly with the lids of the trolley, okay, before transportation. And it should be, there should be a assigned document by the nurse or doctor mentioning the date, shift, quantity, destination of the biomedical waste when it is being transported. Special vehicles are also used for this transportation, okay, and these vehicles are not used by anyone else, okay, and no, these vehicles will not be used for any other purposes as well. And also the effects of traffic accidents, like trucks and containers that carry biomedical waste. When they're transported, okay, it is transported in such a truck or container, okay, carriages, that it considers road traffic accidents as well. Even in times of road traffic accident, there is as minimum spillage as possible, okay. Coming to the storage, once the collection is done, biomedical waste is stored in a proper place. Okay. Segregation of different categories has to be identifiable in the storage places as well. Okay. Some hospitals have rooms which are color coded with the proper color coded bins as well, so that these colored waste will go into this storage rooms. The duration of storage should not exceed more than 10 hours for big hospitals and not more than 24 hours in nursing homes. That is the new law. Then a lot of treating methods are used to take care of the biomedical waste: incineration, treating decontamination, okay, sterilization, chemical treatment, physical treatment, okay. There are different types of treatment: heat treatment, okay, thermal treatment of waste is also done, burning the waste, okay. There are different treatments given, and whatever remains back, okay, after treating, whatever remains back is disposed of properly. These are the steps in waste management. Principles of waste management. Waste management plan is based on the current situation, which minimizes waste generation. As less as possible waste should be generated. Segregate clinical waste from non-clinical waste in dedicated containers. Non-clinical waste are not that hazardous in nature. Transport waste in dedicated trolleys, which will not be used for any other purposes. Store waste in specific areas with restricted access, which means anyone who is not from the healthcare department or healthcare field or even from the hospital will not be able to take care of it or come near the waste that has been collected. That is general public, visitors, patients, family, okay, they will not be coming near the waste that you have collected. So this is what segregation allows, okay, and restriction allows. Only nurses, doctors, or any healthcare professionals who are a part of patient care will be allowed in the allowed in the areas where biomedical waste has been segregated. excuse me. Collect and store sharps in sharp containers, which is made of either metal or plastic. But it has to be puncture proof. It should have a lid. It should not be completely full. It should have a biohazard symbol. And the main thing, it has to be puncture proof. Whatever plastic or metal it should be puncture proof. Trolleys for biomedical waste should not be used for any other purposes. Keep it in storage area, okay, before treatment and before final disposal for 10 hours to 24 hours, depending on what kind of a hospital or healthcare facility you own. So segregation of waste can be done in these categories as well. Infectious non-sharps, infectious sharps, okay. Infectious non-sharps strictly in yellow containers. Infectious sharps, okay, in puncture-proof containers. Glass also in puncture-proof containers. Cytotoxic and radioactive drug in a lead container. Microbiological and pathological waste in a yellow container. Disposable plastic could be in a blue container as well, black or blue container. And general waste, paper, cardboard, again black container. Okay. So according to the WHO, World Health Organization, these are the categories that World Health Organization uses now, not the previous 10 categories. Okay. So the type of waste, if it is highly infectious, it is marked, it is yellow colored bin, and it has to be marked biohazard or highly infectious. It has to be written highly infectious along with a biohazard symbol should be there on the bin. The bin should be strong. It should be leak proof, plastic bag or container capable of being autoclaved completely. Okay. Then other infectious waste, pathological and anatomical waste and sharps that are being used. Okay, yellow, again yellow with biohazard symbol should be there. Leak proof or container. And sharps, it could be any color. Sharp container could be at any color, but it is preferred to be yellow. Okay, again it has to be written as sharps in block letters, bold letters with biohazard symbol. The important thing in sharp container is it should be puncture proof. Okay, and not be filled up till the brim. Three-fourth is filled up, only one-fourth space is remaining. It has to be emptied. Chemical and pharmaceutical waste, brown color bins. Again, appropriate hazard symbol should be there. Rigid container. Rarely pharmaceutical waste require puncture-proof container, but it has to be a rigid container. Radioactive waste, it should be in a lead box, and radiation symbol should be there on the lead box. And any other general healthcare waste, which is disposable, plastics, papers, and all. Okay, black bin, or it could be a plastic bag as well. So treatment of clinical or hazardous waste, hospital should outsource the biomedical waste to an authorized contractor. For every 75-kilometer radius, there is one biomedical waste contractor. Okay, and these contractors are designated by the State Pollution Control Board. Okay, 75-kilometer radius, how much ever nursing homes, healthcare facilities, veterinary hospitals, big hospitals, government hospitals, private hospitals, whoever is there in a 75 kilometer radius. Okay, whatever waste, biomedical waste, these healthcare facilities uh, produce, it has to be taken care of this common segregator contractor. Okay, and whoever is handling biomedical waste handlers who are handling the waste should always use personal protective equipment at all steps of biomedical waste management. Okay, and transport the waste in closed container. You can see here it is half open. It should not be like this. It should be completely closed container. Okay. So how do you treat these waste? Okay, treatment of this waste. If it is sharp, okay, anything that can hurt you, sharp waste, what you will do? Okay, pre-treatment is required for handlers' safety. Without treating the sharps, don't give it away to biomedical waste handlers. Okay. So autoclaving is the best form of pre-treating the waste. Autoclave the sharps, all the sharps, or microwave the sharps, shred the sharps, okay? And the shredded sharps, one, because it is metal and glass, it will not undergo decomposition. So it has to be put into landfill, okay? Or you can also use plasma pyrolysis step for the puncture-proof containers in which these sharps are carried. In plasma pyrolysis, what you do is you burn the entire container in the absence of oxygen. Okay. Deep burial is also done in a secure area with whatever is left of the burnt part. And burial should be always 2 to 3 meters deep in its depth, at least 1.5 meters above any groundwater levels. You don't want to pollute the groundwater. When it comes to anatomical waste, okay, waste that require incineration, which all are the waste that you can burn, okay, which you can incinerate. So all the anatomical parts of the animal or human body parts, okay, cytotoxic drugs can be burnt. Toxic lab chemicals can be also burnt except for mercury. Mercury should not be burnt. Things that may be or may not be burnt, patient contaminated non-plastics. Okay, some materials can be burnt, some may not. Non-chlorinated plastics can be burnt. Okay, chlorinated plastics should not. You should never burn chlorinated plastic. Non-chlorinated plastic, you can burn it. It will not produce the chlorine gas. Waste that should not be incinerated, which are the waste which you should not burn at all. Okay, any materials that are treated with sodium hypochlorite, bleach. Okay, any materials that are treated with bleach, do not burn it. Chlorinated plastics, don't burn it. Mercury, any metal that has mercury, any item that has mercury, do not burn it. Any fluid, contaminated plastic or non-plastic should not be burnt. Such waste should be treated in autoclave first, and then it should be shredded. And whatever remains of the remains back after shredding, it will be sent to landfill or deep burial. So deep burial, this is not given in the textbook, it's just for your knowledge. So this is how a deep burial looks like, cross-sectional image. So the depth of the deep burial, it is 2 to 3 meters deep, 1 to 2 meter wide, okay, in nature. And you can see how the waste is put. The bottom layer is of clay, okay, or any geosynthetic layer will be there, or clay. Then you have a lime layer, soil lime layer. Then you will put the biomedical waste, and then again you will cover it with soil or lime layer. Then you will cement it, okay, so that no animals can reach up to this, up to the biomedical waste, okay, or no humans can reach up to it. Flooding will not also will not affect the deep burial. So cementing is done. You will pour the cement, you will close it forever, and then you will put 50 centimeter of soil. You will cover the biomedical waste with 50 centimeter of soil. And on the sides of the deep burial, you can see it is a slanting image. Okay, a slant is there. Okay, so this earth mount is made to make sure if nearby any rivers are there, when the rivers flood, the flood should not uh, the deep burial should not go away with the floods. Okay, the flood water will not reach the inside of the deep burial. For that reason, the sides of this deep burial, it has a earth mount. Slightly elevated sliding format is given here. That will prevent flooding. Okay, so bins and liners. Optimum number of bins you should have in your healthcare facility. You should you should not run out of it. Okay, it should be easy to use, standard, uniform. Every ward should have a uniform looking bins. Okay, foot operated bins. There's a paddle, you strike on it and the lid will open. Okay? And it should be placed at all clinical areas. This is how the bin looks like. Liners, you can see this plastic bag. This is a liner. Here also you can see in the bin there is one liner. Okay. Color should match the plastic. You can see here, yellow bin, yellow liner. Okay. 1/4 of the liner should be out of the bin. You can see here it is turned out upside down, so that when the biomedical waste handlers come, they will directly pick up this part which is outside of the bin and they will tie it up. Okay, so they are safe. The biomedical waste handlers are safe. This is the biodegradable and non-chlorinated plastic. Biodegradable and non-chlorinated plastic, leak proof, and it fits the container as well. Next, collection, storage, and labeling and recording of the waste. Label includes, when you are doing labeling, collection and storage we have discussed earlier. Labeling, waste, what type of waste you are traveling with, which department was the site of generation, okay, from which department you collected this particular bag, and date of generation, at what date. Okay, these three things should be there on the label. Date and time is important because you can keep that time limit for storage. Storage at a safe point of generation for an interim period. That interim period is 10 hours to 24 hours within the facility. Do not store untreated biomedical waste beyond 48 hours within the premises. And if you have to store in certain critical cases, you have to store. So like natural disasters or something has struck and there is no other way, but you have to, or pandemic, severe situation of pandemics and all. So beyond 48 hours, you may have to store the biomedical waste, but for that you will have to take special permission from the Pollution Control Board. Staff should duly fill all the labeling, okay, and they will also handle a report book, waste book, color wise, mention the code number also, what was the weight of the and size of the bag before biomedical handlers took it from the department. So these details has to be maintained by the ward or clinical department. When it comes to liquid waste, liquid or chemical waste, chemical disinfection of the liquid waste is done, and then only it can be sent into the sewers or drainage. Okay, so how do you do the chemical disinfection? Whatever is your liquid waste that you have generated, mix it with 1% of bleach, 1% of bleach for 30 minutes. Okay, mix the liquid waste, keep it with 1% of bleach for 30 minutes, then discharge it into drain and sewer. Okay, you don't have to physically mix it. Whatever liquid waste is going down your wash basin, it can get collected in a completely different container in which 1% sodium hypochlorite solution is already there. Okay, and then it can go into the drainage. But then after 30 minutes you can release it into the drainage. Okay, that kind of mechanism can be installed in the architect of the all wash basins near healthcare departments. Finally, when this mixture of sodium hypochlorite and liquid waste enters the drainage or sewers by the principle of dilution and dispersal. Dilution and dispersal means if you put one bucket of biomedical waste or liquid waste or some toxic waste into the ocean, it will not harm the ocean because uh, that one bucket of toxic waste will easily get diluted without causing any environmental harm to the planet. Okay, the ocean water is that vast in nature. Okay, so that is the principle of dilution and dispersal. Okay, when the main source of body is vast in nature physically, okay, one bucket or few liters or some tons of water, wastewater, will not do any harm. So coming to the categories of waste, earlier we had the 10 categories of waste which we don't use anymore. Okay, now it is just sharps, infectious waste, pathological, pharmaceutical, cytotoxic, chemical, radioactive. In a table they have given, sharps is like all broken glass, scalpels, needles. Okay, IV needles, whatever, broken instruments, metals, okay, they all come under the sharps, which can inflict injury, okay. Infectious waste, anything that has touched the patient's body, consider that as infectious. Anything that has touched the patient's body, blood, body fluids, okay, any article, that is infectious. Pathological, body parts, carcasses, okay, biopsy samples from the pathology lab, okay, tissues, tissue cultures and all that has been done, that is pathological. Then cytotoxic, pharmaceutical and cytotoxic, uh, chemotherapy drugs, okay, if you have an oncology department, if you have a chemotherapy department, okay, whatever drugs are used there, expired or being in use, those are cytotoxic in nature. Expired drugs also comes under pharmaceutical. Chemical, disinfectants, bleaches, okay, expired disinfectants, laboratory reagents used, okay, acids used, phenyls that are used, these all are chemical waste. Radioactive waste, if you have a nuclear medicine, you will have a radioactive waste, okay, isotopes and all used in nuclear therapy, nuclear medicine therapy. So these are the different symbols. Cytotoxic hazard for chemotherapy drugs, needles, syringes used in chemotherapy, they will put the cytotoxic symbol. Then next you have is the biohazard symbol. It should be put on the bins also. Biomedical waste management bins, different color coded bins should have the biohazard symbol. Then you have nuclear medicine symbol, radioactive. Okay, any products that are radioactive in nature will have this three fan symbol in yellow and black. Then you have the corrosive symbol, substances that can attack and destroy the living tissues. Okay, that come under the corrosive substances. It's the corrosive symbol. Then highly flammable symbol, substances that can easily catch fire. Flash point of around just 21 degrees Celsius to 55 degrees Celsius. Now concluding the entire waste management, okay, biomedical waste management. This is the totality of hospital waste. Okay, 85% of it is hazardous, 15% is non-hazardous. Okay, so that non-hazardous waste, again, it comes in two category. One that can undergo can become a compost. One that is inorganic in nature, cannot be decomposed. Okay, can be recycled maybe, or will go in the landfills. Biodegradable, that is decomposed. Okay, it can go into compost. You can make a composting out of it. Then hazardous waste. Okay, hazardous, two types of hazards are there: infectious hazards and chemical or radioactive hazards. Okay, so chemical and radioactive hazards, take care of it using lead boxes, okay, lead rooms, cytotoxic drugs and all. You can burn it. Okay, when it comes to infectious waste, there are again two types: infectious waste that have touched the patient, infectious waste that have touched the patient, and it can cause harm to you as well. It can hurt you as well. So that is sharps. Non-sharps means cotton, gauze pieces, any plastic tubings and all that has been touched by the patient's body, blood, body fluid. Okay, that comes under non-sharps. So when it is a sharp, anything sharp, needles, scalpel, broken glasses, glasswares, so okay, these are sharp in nature. Sterilize them, shred them, and bury them. That's it. That's how you take care of sharps. Sterilize them, okay, because you have to treat them. Then you will shred them, and then final burial is done. When it is about the non-sharps, it comes from patient care and one comes from laboratory. Okay. In patient care, again, you have plastics and non-plastics. Plastics, you will never burn it. Okay. If it is non-chlorinated, you can burn, but plastics, you will never burn it. You will sterilize it, shred it, and it will go into the landfill. Okay. And which is non-plastic, which you can burn. Okay. Like cotton, gauze dressing. Okay. Excretions of blood and all. Okay. It can be sterilized. It can be shredded, or it can be completely burnt off. Okay. and whatever ash remains, that ash goes into the landfill. Coming to the laboratory waste, okay, not patient care, laboratory. In laboratory, you have specimens, okay, you have microbiological lab waste, anatomical waste, biopsy samples, body parts, okay, animal carcasses. So body parts, biopsy samples, animal carcasses, directly burn them, cremate them, ash will go into the landfill. Microbiology waste, in microbiology lab, what all test is done, okay, the petri dishes and all, steam sterilize it, shred it, and whatever if it is liquid waste, it will go into the drainage. Solid waste will go into the landfill. Specimens like blood specimen, you give blood sample for test, urine sample for test, okay, sputum samples for test, okay. So these will be discarded, and the containers will be steam sterilized, shredded, and it will go into the landfill. So that's about